Perforator flaps are a type of reconstructive surgical flap used to transfer tissue for repairing defects or reconstructing body parts, particularly after trauma, cancer surgery, or congenital defects. These flaps are based on perforating blood vessels, which are small vessels that pass through or between muscles to supply the overlying skin and subcutaneous tissue. Key features of perforator flaps. 1. Blood supply. The flap's viability depends on perforator vessels arising from a deeper source artery. Examples include deep inferior epigastric artery perforator, DIPE flap for breast reconstruction, anterolateral thigh, ALT perforator flap for extremity reconstruction, superior gluteal artery perforator, SGAP flap for buttock reconstruction. 2. Preservation of muscle function. Unlike muscle or musculocutaneous flaps, perforator flaps spare the underlying muscle, preserving function, reducing donor site morbidity, and improving recovery. 3. Tissue composition. These flaps consist mainly of skin and subcutaneous fat, making them ideal for soft tissue coverage or replacement. 4. Versatility. They can be designed as free flaps, transferred to distant sites via microsurgery, or pedicled flaps, rotated locally to cover defects. 5. Aesthetic and functional benefits. Reduced scarring, minimal donor site complications, maintenance of natural contour at both donor and recipient sites. Surgical technique. 1. Preoperative imaging. Tools like CT angiography or Doppler ultrasound identify perforators, ensuring precise flap design. 2. Flap harvest. The surgeon carefully dissects the flap along the perforators to preserve blood supply. 3. Microsurgery. In free flaps, microsurgical anastomosis connects the perforator vessel to recipient vessels. Applications. Breast reconstruction. DEEP, SGAP, and other perforator flaps create natural-looking breasts. Head and neck reconstruction. ALT and radial forearm perforator flaps provide soft tissue coverage. Limb salvage. Perforator flaps can cover exposed bones, tendons, or hardware in extremity reconstruction. Perforator flaps represent a significant advancement in reconstructive surgery, offering improved functional and cosmetic outcomes compared to traditional flaps. Perforator flaps are a type of reconstructive flap used in plastic and reconstructive surgery based on blood supply from perforating vessels. These vessels pass through or between muscle layers to reach the overlying skin and subcutaneous tissue. Below is an enumeration of commonly used perforator flaps, grouped by their anatomical regions. Head and neck. 1. Supratrochlear artery perforator flap. 2. Occipital artery perforator flap. 3. Superficial temporal artery perforator flap. Thoracic region. 4. Thoracodorsal artery perforator, TDAP. 5. Internal mammary artery perforator, IMAP flap. 6. Lateral intercostal artery perforator flap. Abdominal region. 7. Deep inferior epigastric artery perforator flap. 8. Superficial inferior epigastric artery, SIA perforator flap. 9. Transverse abdominis myocutaneous perforator flap. Pelvic and gluteal region. 10. Superior gluteal artery perforator, flap 11. Inferior gluteal artery perforator, IGAP flap. Upper extremity. 12. Radial artery perforator flap. 13. Ulnar artery perforator flap. 14. Lateral arm perforator flap. Lower extremity. Anterolateral thigh ALT perforator flap. 16. Medial sural artery perforator flap. 17. Lateral sural artery perforator flap. 18. Posterior tibial artery perforator flap. 19. Peroneal artery perforator flap. Miscellaneous. 20. Dorsal metacarpal artery perforator flap. 21. Plantar artery perforator flap, foot. These flaps are widely used for reconstructing soft tissue defects while minimizing donor site morbidity. The choice of flap depends on the defect location, patient anatomy, and reconstructive needs.